Hi viewers, today we'll see post-operative care for orthosurgery. I'm Dr. Kaliselvi Xavier, Professor, Triple M College of Nursing. At the end of the class, the students will be able to mention the meaning of orthosurgery, describe the indications of orthosurgery, explain the post-operative general instruction, specify the guidelines of post-operative surgery, and enumerate the nursing process of orthopedic surgery. Encompasses the entire process of caring for the surgical patient. When diagnosing evaluating to the pre-operative evaluation through the post-operative and rehabilitative period. So although the surgical procedure itself is a very important step towards helping the patients, so nurse and also the team should have a preliminary and follow-up care can determine whether the patient's surgery is successful. Orthopedic surgery or orthopedics is the branch of surgery concerned with conditions involving the musculoskeletal system. Now we'll see indications for orthosurgery. The first indication is knee osteoarthritis. It is known as arthrosis or degenerative joint disease, most commonly chronic joint conditions. Here, the protective cartilage in the joints progressively break down and resulting the patient have a symptoms of joint pain, swelling, stiffness and limited range of motions. Nearly the mostly affected osteoarthritis estimated 215 million cases worldwide. Then the prevalence of knee osteoarthritis is expected to increase in coming years because the increasing aging, the obese populations also will have the risk of osteoarthritis. Currently there is no cure of knee osteoarthritis. So treatment focus on relieving and controlling pain and symptoms, the symptomatic management, and also preventing disease progression, minimizing disability and improving quality of life. The most of the drug prescribed for knee osteoarthritis patients, topical or oral analgesic and anti-inflammatory drugs. So ultimately severe knee osteoarthritis leads to highly invasive surgical intervention, that is total knee replacement. The second indications, fracture at risk of non-healing. When these conditions, the fracture that has not healed within the expected normal period after the initial injury, that is 3 to 4 months, and is at risk of non-healing. When the traditional options of the treatments of an impaired fracture typically involve highly invasive surgery, that is a bone graft, which can be painful and also require months of rehabilitation with the risk of serious complications. So due to this risk of current treatment, orthopedic surgeons often take a wait and see approach, sometimes for several months, which delays the patient's return to the normal life and leads to a significant burden for the family members. And also ALAP is an allogenic differentiated osteoplastic cell therapy product which is developed for the treatment of the orthopedic conditions and bone disease. Allogenic cell therapy involves the harvesting of cells from the healthy donor rather than from the treated patients. The ALAP has the potential to become a first line and every early treatment for delayed union fractures. So we have to minimally invasive administration that should be avoided, like major surgery. The third indications for orthosurgery is a spinal fusion procedures. It is considered as the gold standard surgery for treating a broad spectrum of degenerative spine disorders, which including degenerative disc disease, spondylolisthesis, scoliosis, and stenosis to relieve pain and improve functions. The spinal fusion consists of bridging two or more vertebra with the use of a cage and graft material, which is traditionally autologous bone graft placed into the intervertebral space for fusing an unstable portion of the spine or immobilizing of painful vertebral motion segment. Although spinal fusion surgery is routine, non-union, and also the failure to relieve lower back pain are unfortunately still frequent as up to 25 to 30% of spinal fusion. Patients are not completely satisfied with their surgery. Bone therapeutics products are intended to decrease the failure rate of spinal fusion surgeries. Now we'll see post-operative general instructions. First one is the wound dressings. After the surgery, the following surgery, keep the wound clean and dry. Always we have to visualize and assess. The dressing should be removed and the wounds covered with adhesive bandages on the first or second day after surgery. We should not remove the paper strips or cut any of the visible sutures. Then if need, reapply the ACE wrap if applicable for 5 to 7 days to control swelling. The wound should be kept dry for 48 hours unless otherwise instructed. Fifth day after surgery, the wound may be exposed in the shower, taking care not to scrub the area. The wound should not be submerged in the bathtub or pool until the sutures are removed. Icing. It is very important to apply ice for the first 5 to 7 days after surgery if need or which is prescribed by the physician. While the post-operative dressing is in place, applications of ice should be continuous. Once the dressing is removed on the first or the second day, ice should be applied for 20 minutes periods, 3 to 4 times per day. Care must be taken with ice to avoid frostbite. Then mobility. Follow weight bearing instruction at discharge. Crutches or a cane may be necessary to assist walking. Elevate the operated limb for the first 72 hours to minimize swelling. The post-surgery, the anesthetic drugs used during the surgery may cause nausea for the first 24 hours. If nausea occurs, drink only clear liquids, the only solid food that should be eaten. If nausea and vomiting become severe or the patient shows signs of dehydration, lack of urination. A low-grade fever is not uncommon in the first 24 hours but is unusual beyond inform doctor with any temperature over 101 degrees. If a spinal anesthetic was used, patients may suffer a spinal headache, inform surgeon if not relieve the pain with Brufen or pain medication. Patient may take a little aspirin daily until the sutures are removed in the office, as this may lower the risk of blood clot developing after surgery. And also the patient should having the severe pain in the affected limb or significant swelling of the joint occur, inform immediately the doctor. The pain medication, local anesthetics are put into the incision after surgery. It is not uncommon for patients to encounter more pain on the first or second day after surgery. This is the time when swelling peaks. Taking pain medication before bedtime will assist in pain. It is important not to drink alcoholic beverages or drive while taking narcotic medications. A prescribed narcotic medication, Vicodin, hydrocodone, darvocet, supplement these medications with the 200 mg or 400 mg of the profen every 4 to 6 hours. The patient should receive their normal medications for the other conditions the day after surgery. Then activities. Most patients are able to drive if surgery does not involve the right leg as soon as they stop taking narcotic pain medications. While driving under the influence of narcotic pain medications is dangerous, illegal, and also it is discouraged. Returning to the work or also depends on the degree of the postoperative pain and also demands of the job. The pain is generally a good guide as to whether the patient can return to the hospital. What are the follow-up to be informed? When the doctor will need to re-examine the patients 7 to 10 days after the surgery. In between anything is happened, they have to be called immediately to the concerned physicians, and also according to that schedule the appointment to be taken. If unexpected problem emergencies, immediately to come to the emergency area. Then now we'll see the nursing process, the postoperative care of the patients undergoing ortho surgery. Here the assessment is main part. While assessing orthopedic surgery, the nurse continuously preoperative care plan. Following to that, the postoperative status, reassess while the patient is having pain, neurovascular status, and what is the health promotion and mobility and self-esteem to be assessed. Then skeletal trauma and surgery performed on bones, muscles, or joints can produce significant pain, especially during the first 1 or 2 post-op days. Then nurse to be watched, tissue perfusion must be monitored closely if the patient is having edema, bleeding into the tissues can compromise circulations, result in compartment syndromes. So inactivity contributes to venous status and develop DVT. That to be informed immediately to the physician. General anesthesia, analgesia, and immobility can result in altered functioning of the respiratory, gastrointestinal, and urinary systems. The nurse should note prescribed limitation, mobility, and also understanding of the restriction of the mobility. The nurse discuss the plan of care of patients and encourage the active participation plan. And also the nurse additionally to monitor the potential problem related to surgery, and also should do vital signs, level of consciousness to be assessed, neurovascular status, wound drainage, breath sound, bowel sound, fluid balance, and pain provides the nurse with the data. Suggest possible development of the complication also to be assessed. The nurse reports abnormal finding immediately to the patient. With major orthopedic surgery, there is a risk of hypovolemic shock because of the blood loss. The muscle dissection frequently produces wounds in which hemostasis is poor. Wounds that are closed under tourniquet may bleed during the postoperative period. So the nurse must be alert for sign of hypovolemic. When the changes in the patient's pulse rate, respiratory rate, or the color may indicate pulmonary or cardiovascular complications. Atelectasis and pneumonia are common and may be related to pre-existing pulmonary disease, deep anesthesia, decreased activity analgesia, and reduced respiratory reserve due to advanced age or an underlying musculoskeletal disorders, that is restrictive lung expansion secondary to kyphosis, rheumatoid arthritis, and osteoporosis. Voiding in unnatural positions may contribute to urinary retentions. In addition, elderly men usually have some degree or prostate enlargement, so they may already have difficult voiding. Therefore, it is important to monitor urinary output. Temperature elevation within the first 48 hours are frequently related to atelectasis or other respiratory problems. The temperature elevations during the next few days are frequently associated with urinary tract infections or the superficial wound infections. So it will take 4 to 6 days to develop. Fever from phlebitis usually occurs during the end of the first week through second week. Thromboembolic disease is one of the most common and most dangerous of all complications occurring in the postoperative orthopedic patients. It should be watched regularly. Advanced age, venous stasis, lower extremity orthopedic surgery, and immobilization are significant risk factors. The nurse assesses the patient daily for cough, swelling, tenderness, warmth, redness, and positive hormone signs, that is, cough, pain, and dorsiflexion of the foot. The nurse promptly reports abnormal finding to the. In addition, fat embolus may occur with the orthopedic surgery. The nurse must be alert to changes in respiration, behavior, and level of consciousness that should be suggest the development of fat embolus. The nursing diagnosis: acute pain related to surgical procedures, swelling, and immobilization. The second, we can frame impaired physical mobility related to pain, edema, or the presence of one immobilizing device. Example: splint, cast, brace. Third could be nutritional, if the patient is having nutritional problem, urinary problem, or the patient is having any knowledge deficit, we can frame according to prioritize. Then the potential for risk: all cerebral neurovascular dysfunction, ineffective therapeutic regimen, and situational low self-esteem to be framed. Problem. Planning and goals: orthopedic surgery may include relief of pain, adequate neurovascular function, health promotion, improved mobility, positive self-esteem, and absence of conscience. We have to monitor the complications: hypolimixia of atelectasis, pneumonia, urinary retention, infection, venous stasis, and DV. The expected patient's outcome: reports decreased level of pain, uses multiple approaches to reduce pain, and occasional oral medication to control discomfort, elevate extremity to control edema and discomfort, moves with greater comfort. And also we have to watch for the neurovascular functions: exhibits normal color and temperature of the skin, has warmth the skin, has normal capillary refill response, demonstrate intact sensory and motor function, demonstrate reduced swelling. Promotes health: we have to assess, see, watch the patients whether they are eating appropriate nutritional needs, maintaining adequate hydration, abstain from smoking, practice respiratory exercises, reposition self to relieve pressure on skin, engages in strengthening and prevent exercise. The fourth maximizes mobility within the therapeutic limits, requisites assistance when moving, elevates edematous extremities after transfer, uses immobilization devices, complies with the prescribed weight bearing limitations. Then we have to improve the positive self-esteem through discusses temporary and permanent changes in the body image, discuss role performance. We have to view self as capable of assuming any responsibilities, actively participates in planning care or the therapy. Then exhibits absence of complications. When you are seeing the evaluation, does not experience shock, maintains normal vital signs and blood pressures. The lung sound should be auscultated, it should be clear, demonstrate wound healing without sign of infections. The patient does not experience urinary retentions, and the patient should voids clear urine, clear, exhibits no signs of DVT. Amen. Thank you for patient listening. These are all the references.